Hello, friends. On this World Homeopathic Day, Dr. Hanuman Sir's birth anniversary, we will be completing our 1 year of integrated homeopathy. So, on this auspicious occasion, we decided to do something different. So, dear friends, cancer cases are increasing day by day. And we have seen that there is no single treatment which is curative or palliative for cancer. So we decided to take this up, integrated approach towards cancer. And the name which flashed in my brain was Dr. Zubin. He is my classmate, and I'm really happy to introduce him to you all. Dr. Zubin Marolia has been working in the field of cancer from last more than 30 years. He is a senior consultant homeopathic physician who has been healing patients from 30 years. He is a specialist in integrative oncology. He is honorary homeopathic oncology physician at Mumbai Homeopathic Hospital, Mumbai. Dr. Zubin Marolia is trained at Memorial Sloan Kettering Cancer Center, New York, USA, in the Department of Integrative Medicine, and has also delivered a lecture in palliative care and homeopathy in Sloan. Dr. Zubin sir is one of the distinguished homeopathic physicians from India to be invited to speak at the esteemed Johns Hopkins University School of Medicine, USA. He spoke on thought patterns in cancer patients. Before the cancer develops, the cancer psyche. Dr. Zubin Marolia has received his fellowship in integrative oncology from Filderkling, Germany, and shared his experiences at the Medical University of Vienna. Dr. Marolia is invited to speak in Germany at all the integrated medicine meeting from 2012 to 2023 on mistletoe therapy. He has over 30 years experience in homeopathic treatment and management of cancer patients, both in curative and palliative approaches. Dr. Marolia has treated hundreds of cancer patients all over India and abroad in different stages in his medical career, combining homeopathy and mistletoe therapy. Recently, he was invited to speak at the World Congress on Integrative Oncology 2023 in Germany. His mantra in integrative oncology: heal the person, enhance the quality of life, not just remove the cancer. So, dear friends, presenting Dr. Zubin Marolia, speaking on cancer management integrated approach. Dr. Zubin, you can start. Can you please give us your short journey, long journey in short?
Long journey in short. Okay.
Covering all aspects, how you graduated in homeopathy and how you got attracted to cancer treatment.
Okay. So a very good evening to everyone. First of all, thank you, Dr. Anita, Dr. Shobha, Dr. Nirupama, Dr. Kushala, and Dr. Aditi for inviting me to share my concepts in healing cancer patients using an integrated approach with homeopathy and mistletoe therapy. And firstly, before I start about my work, I would like to compliment this group of integrated homeopathy, which has been doing a very fine research and posting various studies on homeopathic remedies, homeopathic materia medica. Many of you don't know, but I go through your PowerPoint presentations and I learn a lot. So first of all, my kudos and my compliments to you all for the wonderful work in keeping the homeopathy flag flying high. So let me start with, since Dr. Anita has mentioned my journey, how did my journey begin in the field of this particularly very challenging subject of cancer and oncology? And it's been now about 34 years that I've been in this field of encountering a cancer patient, their family members, the relatives, oncologists, radiation oncologists, oncosurgeons, oncophysicians, And it's so demanding on me, and I'm thankful to God for giving me the energy and courage to continue like this. It's almost 34 years over now. So I'll tell you a short story, Dr. Anita. So this is way back in 1989 when I was working with Dr. Kasad. And I was working in his Baikala clinic. One morning, there was a patient with a fungating tumor of the alveolus, a carcinoma of the alveolus, with a full fungation, and he had come with a turban around his head. And he was sitting in the outside chamber before Dr. Kasad could call him. And when I went to call this particular patient, the whole waiting hall was having a very, very bad odor, a stinking odor from the necrosis, the discharge, the infection, and the maggots. So we slowly call him to the chamber, and he's very, very weak. He's coming from a village in Gujarat. I still remember 35 years ago in 1989. And he is made to sit by Dr. Kasat, sir, and I am there with him. I was an assistant. I was brimming with confidence and verve and vigor to find out what we can do for a cancer patient. So we take the basic history, and we can't sit in the room. The odor was so offensive. So Dr. Kasser advised him to remove the turban, remove the entire covering of the face, and it was full of maggots, and there was a full ulcer from the mouth, the cheek, the bone, the mandible, the jaw, going towards the orbit. And there were maggots inside. That was my first experience of seeing a cancer patient. And at that time, because of the odor and the ulceration, Dr. Kasser had given a homeopathic remedy, Merc Cinatum, Mercurius Cinatus 30, QDS. And that is how the patient got palliative relief. The burning became better, the odor became better. Of course, he was given a palliative line of treatment, but that is the first time that I saw that a homeopathic remedy can actually make a difference in the quality of life of a cancer patient. Now, my dear friends, this is very important. Quality of life in a cancer patient is extremely important. So I asked Dr. Kasser, I said, and he had given him mistletoe therapy, he had given him Iscador. So I asked Dr. Kasser, I said, sir, Asu che, what is Iscador? What you're given Mercurius cyanide, but what is Iscador at that time? So he says this is Iscador is nothing but viscum album made from the mistletoe plant, what we call in homeopathy viscum album. And I tell him that I want to learn more about this and I want to study more about this. And at that time, I was very, very passionate about learning, about knowing new concepts in homeopathy. And there was no MD at that time. As you all know, 1989, I was the second BHMS batch. So I really wanted to put all my energies and know what this is. So he mentioned that this you can study in Switzerland. There is a naturopathic clinic which gives knowledge on mistletoe and its use in cancer. So this was the Lucas Clinic in Switzerland. And I write to them and I get admission in the Lucas Clinic to study mistletoe therapy in a seminar. And then I was staying over there and working with immunologists from Europe. And Anita, you can imagine my joy of working with top European doctors at such a young age. And I was 24 and a half years old, young boy. And I went over there and I learned the aspect. I used to go on rounds of patients, seeing how different cancer patients were being treated. And that is when I know about mistletoe therapy. So today's very, very interesting subject on mistletoe, our viscum album and homeopathy, has a very, very important role to play in the life of a homeopathic physician. And today in the world, mistletoe is the #1 alternative plant-based medicine in oncology. And all over the world, there has been an awakening on how to use mistletoe in India, in Europe, in the United States, in Asia as well. I have just returned from Florida, where I was doing a conference on the immunomodulatory properties of mistletoe plant. So basically, my journey involves knowing about the mistletoe plant way back in 1989. 1991, I was in Switzerland. 1994, I again go back to the Lucas Clinic to work and gain clinical experience in mistletoe therapy in advanced oncology patients, stage 3, stage 4, and what other therapies Europe is using along with mistletoe and homeopathy. I got married in 1994. My son was born in 1995. In 2007, I gave a few seminars in Europe. And 2009, I was invited to work and be a part of the top cancer hospital in the world, the Memorial Sloan Kettering Cancer Center in New York, in the Department of Integrative Medicine. And I consider it a privilege and honor of being a homeopathic physician in India to get the opportunity to go over there and learn from Sloan Kettering Hospital and their cancer doctors. I come back to India, I continue my practice. In 2013, I was invited to speak on a very interesting topic, the cancer psyche of a cancer patient, what goes on in the mind of a cancer patient before the tumor develops. The tumor is the gross pathological change, it is not the disease. So I was invited to Johns Hopkins University School of Medicine from India to give a talk in 2013. 2016, I worked with an oncologist in the Medical University of Vienna. In 2019, I was doing an event in California on Truth About Cancer series. If you Google down the largest truth series on alternative cancer treatments on the internet is the Truth About Cancer series. And I was invited to California along with another doctor from India to present my work, which is the 3 S's concept in healing. And that is a little bit about my journey. I continue the work over here. I have an oncology OPD where we also see general patients on every Tuesday at our CMP Medical College and Mumbai Homeopathic Hospital. And I have a full integrative oncology team now in Rich Candy Hospital, wherein we work together with top oncologists in Mumbai and India. So that is, in short, about my journey, what caught my interest in mistletoe. And before I hand over the mic to your co-doctor, what impressed me the most in all the patients I saw with Dr. Kasad who were taking homeopathy and mistletoe therapy was the impact on the quality of life of a cancer patient. Now, the quality of life of a cancer patient is a concept, what is called as salutogenesis. Okay? So health and the origin of health. It was by Aaron Antonovsky. So the salutogenic concept is very, very important to understand in cancer treatment. So what happens to a cancer patient? Is he able to sit? Is he able to walk? Is he able to climb stairs? Is he able to eat his food? Is he able to talk to his family? Is he able to play with his grandchildren? All these aspects are covered in the quality of life of a cancer patient. And that is where mistletoe therapy plays a very, very important role. So today's talk, I will be explaining the concepts on mistletoe and how I have applied it in cancer treatment. And I feel that every homeopathic physician should know about it.
Yeah, thank you, Dr. Zubin. And so now the very natural progression to your talk, the first question arises in the mind is, can you throw some light on the mistletoe therapy, the introduction of mistletoe therapy in the medical science and in the oncology field?
Yeah, thank you, Dr. Aditi. So basically, mistletoe is a half parasitic plant. It's a plant that grows on a host tree. Okay, the host trees can be the oak tree, the pine tree, the fir tree, etc. And like a cancer, it grows on the human host, like how a tumor grows on the human host. Similarly, the mistletoe plant grows on the host tree. So that is the first doctrine of signature similarity between the plant and the disease. We all know in homeopathy about the doctrine of signatures. Secondly, wherever the plant grows on the host tree, it brings about a sort of a swelling or a protuberance on the branch of the host tree, just like a cancer brings about a growth or a lump in the tissue where it grows. Also, if you see the mistletoe plant growing, it grows in all directions, just like a cancer which grows in all directions, wherein the malignant cells multiply in all directions. Also, the leaf of the mistletoe plant, if you see very, very carefully, it has different types of growth in different planes, and the superior layer and the inferior layer of the leaves is not very differentiated. It is undifferentiated, like an undifferentiated cancer. So it's a plant. The mistletoe is a plant. And it's a plant with a lot of tradition. It is a holy plant. And I always tell my patients in India, mistletoe is like tulsi. How we have tulsi in India, which is a holy plant. Similarly, in Europe, they have the mistletoe plant. And I call it the European tulsi. So in Europe, the tradition is like this, that you kiss under the mistletoe plant your partner, and you pluck a berry and you plant a kiss on your partner and say, I love you. So it's a plant of love. It's a plant of romance. So you can imagine that I consider myself truly blessed by God that I have got an opportunity to work on the most romantic plant in medical history. Also, a bit of history. In the earlier 300 centuries back, when there were wars between two European communities, they used to take the mistletoe plant and put a line. And that was called the line of love and peace. And the war used to stop. The war used to stop. Both the communities would come together. So you can imagine the holistic powers of the plant. Okay. Now, this plant basically grows autonomously in all seasons. And they say that even biochemically, the plant has similar structures to a tumor. This plant extract of the summer plant, which grows in the European plantations on the border of Switzerland, Germany, France, and Austria, and the winter plantation. So the summer plantation and the winter plantation is taken, and the whole mistletoe compound is made, and it is used in cancer treatment. So this is a bit of history and introduction. I will take another minute. The discovery of Viscum album and mistletoe was done by an anthroposophical philosopher in Europe by the name of Rudolf Steiner, like our Samuel Hahnemann. And he had an entire philosophy which was very allied to homeopathy. His name is Rudolf Steiner, philosophy, education, medicine, and a way of life. And he saw that this plant can be used for cancer treatment. So it has been used in cancer treatment in Europe since 1918. 106 years ago, it has been used in Europe. And I am using it in India since almost 34 years now, since 1991. So you can imagine the history, and it has documented research on the immunomodulatory properties of the mistletoe. The way the impact it has on the immune system is huge. So I've tried to cover how the plant came into medical history, the doctrine of signature, and the invention and the discovery of this therapy was in 1918 by Rudolf Steiner. And since then, it has been researched and used in various clinics in Europe.
Yes. So, Dr. Zubin, can you help us understand how this therapy is combined with homeopathic treatment?
Okay. So, when we see a cancer patient, let's, for example, you see a cancer patient in different stages. So you have a cancer patient at the diagnosis, during surgery, after surgery, during chemotherapy, during radiation, etc. Now, all conventional cancer therapies today impact the immune system, and they are immunosuppressive. Correct? You get patients with mucositis, with dark discoloration of the face, the hands. They are dehydrated, they are anemic, they are weak, they cannot eat. Now, many a times when you give a homeopathic remedy, like for example, you give muriatic acid for mucositis, or you give sulfuric acid, or you give arsenic album. It doesn't, I have seen in my practice, it helps, but it doesn't help to that much extent. So to aid the action of the homeopathic remedy and to help support the immune system, which has taken a huge suppression by conventional cancer therapies, you need mistletoe therapy and homeopathy to be given in a combined way. And when you give it in the combined way, mistletoe works in a very, very important adjuvant way to patients receiving chemotherapy and radiation. So homeopathy and mistletoe therapy combined together has a much better clinical effect in a cancer patient, and that is what I have been using it all these years.
So, Dr. Zubin, how do you decide? Like, is it that every patient in the clinically you give both homeopathy as well as mistletoe, or in some patients you give only homeopathy, or in some patients you give only mistletoe? Are there any criteria to decide about this?
It's a very, very good question, Dr. Shobha. So there was a research done by Dr. Rastogi, who was using mistletoe and Biscum album and Iscador in Delhi. And according to his study of three groups of patients, one group of around, I think the group strength was about 40, 50 patients who received only homeopathy. The second group received homeopathy and Iscador at that time. And the third group received a combination of homeopathy and Iscador and mistletoe. And the third group had the best outcome in survival period, prolongation of survival of the cancer patient, lessening side effects, helping the cancer patient improve the quality of life, and helping palliative care. So this was one study that I wanted to share. And now many a times cancer patients come to us, it's a very, very difficult journey because for them also, whether to take homeopathy or to take mistletoe therapy. And if you see very, very carefully, cancer as a disease has such a tremendous impact in the life of a patient and their families. So patients and their families want to do maximum possible for the patient. Am I right?
Yes.
Okay. So you are a homeopathic doctor and you are giving your homeopathic remedy. But you know that now there is something like mistletoe, something like Iscador or Helixor, which is used for cancer treatment for 100 years. And the philosophy behind mistletoe and the philosophy of Hahnemann behind homeopathy are very similar. They run parallel, they are allied. So when you know about a therapy which is documented, scientifically researched, it is immunomodulatory, I think it is best to advise a cancer patient to take both in the genuine interest for a cancer patient. However, Shobha, there are cases wherein we only treat them with homeopathy. So I'll tell you a short story over here, a very interesting example. So I saw a lady about, say, 4.5 years ago before COVID. And she comes to me with her son and with her husband, and she's got breast cancer and she has just been operated. And she comes with her hand bandaged. And she's sitting down in my clinic, and I always tell her, and I always start my consultation by this question. And this is the question that is very, very famous in the West. So when I present in the United States, I always tell them that I always begin with this question: is tell me your story. अपनी कहानी बताइए. कहानी क्या है? So then the patients tell me, oh, this is the report, this is chemotherapy, this is this, the histopathology, this is the staging, this is TNM. So I said, I don't want to know. I want to know your story. आपकी कहानी बताइए. Because the cancer history is so long that many a times it takes me 2 hours only to understand the cancer history. So I want to know what is the story. So she says that, I said, open the bandage. So she opens the bandage and she got an ulcer on her hand, a non-healing, huge ulcer about 4 centimeter by 2 centimeter on her hand. Otherwise, she is healthy. She's taken a modified radical mastectomy has been done. Surgery has been done. correct? And she has taken 2 chemotherapies. During the second chemotherapy, the drug extravasated from the vein and it caused localized necrosis. Correct? So she says, Dr. Marolia, she's a Maharashtrian patient. So Dr. Marolia, मला तुम्ही हे बरं करा पहिलं मला कॅन्सरचं काळजी नाही मला हे बरं करा मला हे त्रास देत आहे. So I asked her, I said, काय त्रास तुला देत आहे? In Marathi, what is the problem? So she says that in the morning, my son has to go to work, my daughter-in-law goes to work, my grandchild goes to school. I can't put my hand in water. People are coming and telling me, don't do this, don't do this, don't do that, ye nako karo, don't do this. And now they want to take me for plastic surgery for the hand. She says, I want you to cure me. I said, okay. So very simple case, and in the OPD at Mumbai Devi Hospital also we usually talk about very simple cases. So non-healing ulcer, a non-healing wound. I think what do we use in homeopathy? You can share, Anita. Basic remedy for healthy condition tissue is
Nitric acid.
nitric acid. Aditi, can you add? Non-healing wound. Basic remedy for healing.
Silesia.
Silesia. Kushala.
Even murk, I think, is a good remedy for ulcers.
Murk, correct. Nirupama.
Calendula.
Calendula. Shobha.
Echinacea.
Echinacea. Perfect. So all remedies are covering. So I use calendula. 1 m. Internal pills and calendula application. And the ulcer healed. Ulcer healed beautifully. I've got recorded images. It's a long case, but the ulcer healed. Now the fun starts. So now they come back to the clinic. 2 chemotherapies are over. They come back to the clinic and say, Dr. Marolia, now there are chemotherapies incomplete. Now what do we do? So the patient is saying, Malana is chemotherapy. Why go to the hospital? Again do report. Again do this. Again I'll have the problem. I want to take homeopathy and mistletoe therapy only. Right, Shobha? So the Hassan is saying, no. You have to go back to the hospital, and they begin fighting in the clinic. Husband and son is saying, you have to go back to the hospital. Patient is saying, I'm not going anywhere. I'm coming for homeopathy treatment. Then I had to convince the husband and the son that, look, you have to be patient. You listen to what the patient wants. The patient is now only on homeopathy and mistletoe therapy. No chemotherapy is discontinued. She's living a healthy life. 5 years. Remission, 5 years. So here this case goes to show that with only homeopathy and mistletoe therapy, also patients are doing well. But normally we combine it.
Dr. Zubin, do you also use the cancer nosodes or the cancer organ remedies, like which is very much into the practice, by some of the cancer treating doctors?
Correct. So the commonest remedy that I use for the nosode, of course, is we use carcinosin. But for cancer pains, especially bone pains, acute abdominal pains in advanced cancer patients with ascites, with peritoneal mets, we use syphilinum a lot. I use syphilinum, and normally if you see a cancer patient suffering is more worse at night. So we use syphilinum a lot. In fact, I had a case in Reliance Hospital last year. I saw the patient in November. Very interesting case. Let me share this with you in a quick note. I was called stage 4 ovarian cancer patient, refractory ovarian cancer, metastasis, multiple peritoneal deposits, obstruction. Patient is in frank obstruction. Reliance Hospital. They call me. I think I was in a conference of Dr. Master at the Palliative Oncology Conference in Bombay Hospital. And from there, I go to Reliance Hospital and I see the patient. Okay. Stomach is distended, absolutely bloated, multiple deposits. You examine the abdomen, hard masses all over the abdomen in obstruction. Oncologist coming the next day, chemotherapy to be started. Now here is very, very important. Now homeopath comes into a big hospital. I go. Now I have a very, very simple attitude. That if I have to treat a patient, I will go anywhere. And to enter Reliance Hospital is very difficult, Shobha. So I go there, I take the history. I say, what is the problem? So she says, I cannot pass stool. I'm in constipation, ascites, advanced cancer, gastrointestinal deposits, correct? And I asked her, anything else, any other concomitant symptom? So she says, yes, I have a backache. I have a backache. And she says, I said, okay, what happens to you in the backache? So she's trying to hold on to the side of the bed in the hospital and trying to get up. She says, I have to hold to the bedside and then I have to get up. Correct? So the remedy for cancer, GI cancers, advanced cancers, cancerous diathesis, backache, and yellow coating of the tongue, I give her Hydrastis 0/1. Start Hydrastis 0/1. Every 1 hourly, 10 drops on the tongue. Correct? In the hospital, I am very, very clear. If I have to treat the patient, so patient. 48 hours later, she passes the stool. Obstruction is relieved. I tell the family, I said, look, you have called me. Her general condition, clinical examination has to be very, very strong. So you should know from the face and the general condition of the patient. So I said, clinically, patient is very weak. I don't think you should give any chemotherapy, otherwise the quality of life will be compromised. If you want her to live a good quality of life, it's a stage 4 patient, take homeopathy, take mistletoe therapy, and she will be fine. So she's on mistletoe and she's on Hydrastis, doing well, last about 3.5 months. I just remember the case. So here you can imagine Hydrastis has helped, and she had obstruction at 3 points in her scans.
Yes. Yes, sir. Dr. Zubin, does the case taking differ in mistletoe therapy and homeopathy? And how easily is it available?
So basically, so basically, the philosophies and the understanding of mistletoe and viscum album is very similar to homeopathy. The case taking doesn't differ at all. But you normally understand the cancer psyche in a patient. So I always ask them one very interesting question: that what has happened in your life 1 to 2 years prior to the development of the cancer? Very important. And you will always see lack of love, rejection, grief, and most importantly, you would see a lot of guilt in their lives. I repeat, guilt, aurum, many other remedies, but mainly aurum, relationship, separation, grief, lack of love, and some sort of disappointment in their lives or separation in their lives. So you should always ask this particular aspect. And mistletoe basically is available in Germany. Most of our cancer patients who come for a consultation, when we combine homeopathy and mistletoe therapy, they import the drug from Germany. We start the homeopathic remedy. It takes around 10-12 days to get the mistletoe, and then we combine both and we start both, mainly for immune support. Over here, I would like to mention another very interesting study. So Anita and all, you know about Chernobyl radiation disaster, right, in Russia?
Yes.
You know about Chernobyl, right? So in Chernobyl, what happened? That because of the radiation, the surrounding villages, the children, because they were exposed to radiation, their immune system was suppressed and they had developed recurrent pneumonias. Now, this is a PubMed published article, what I'm telling you. Okay, it's on PubMed. And antibiotics, 1 month, again recurrent pneumonia, septicemia, pneumonia. They were tired. So doctors from the Lucas Clinic in Switzerland were called to strengthen the immune system of those small children who were having recurrent respiratory infections. And they all made with mistletoe because they wanted to strengthen the immune system. Because mistletoe basically is an immunomodulatory therapy. So you can imagine the impact of mistletoe in a damaged immune system, and all the children improved. And there was no pneumonia at the end of 2 years. They were living a healthy life.
So, sir, if we want to apply this therapy, how is it cost effective? I mean, what is the cost that a patient will have to incur?
So It is not a very, very costly therapy. The monthly cost of mistletoe is about 18 to 20,000 rupees per month. 18 to 20,000 rupees per month. So it is not
Much less than chemotherapy.
Much less. One chemotherapy will be nearly about 1 lakh rupees. Just give me 30 seconds, please. Just give me 30 seconds. So it's about 20,000 rupees kushala per month. So it's not very, very expensive.
That's nice.
Yeah, and about the procurement of the medicine, Dr. Zubin, is it we have to get it through, I mean, from Germany or Switzerland only, or like before it used to be available from Delhi? So is it, how is the procurement?
So Kushala basically, sorry, Nirupama basically, sorry.
Aditi, don't worry.
Okay. So
No issues.
Aditi, basically mistletoe is procured. We have an agent in Delhi who imports the mistletoe. So what we do is when we give a prescription for the mistletoe, we give the link of the main pharmacy in Germany. The patients place the order online and they post the injection. So it comes within 10 to 14 days.
Oh, that's great.
Around 10 to 14 days, you can get your supply. And there is a particular person, an agent that has been appointed by the company to help patients in India to get the mistletoe.
So they are mainly injectables, which will be injected by the physician concerned, or is it that the patient is trained to, like how you give insulin shots?
Correct. So basically, it's a subcutaneous injection, and it is given every alternate days. 1 day, and it's also given intravenously, so the patients can take it themselves in the same insulin syringe that they can use, and or it can be given by a local nurse or a local GP.
Zubin, when you're talking about immunomodulation, is it used in any other conditions where there is a lot of immunosuppression because of, steroids, long-term steroids, or like in COVID, or in AIDS, HIV?
Very interesting question. So, in fact, according to research in the last 8-10 years, I've been following up my cancer patients, and those cancer patients that have concurrent diabetes with cancer, and they take mistletoe therapy. Diabetes, type 2 diabetes is autoimmune. The blood sugar levels improve, they drop. When the patient takes mistletoe therapy, now there have been various studies in chronic diabetics, wherein in Europe they are using mistletoe to modulate and optimize the immune system, which has gone in an irregular, imbalanced way and help diabetic patients. HIV patients also, mistletoe is used by Dr. Robert Gorter in Germany, and other autoimmune conditions. Yes, mistletoe is used. Yep.
So it can have a wider application.
Oh, yes, absolutely. It has a wide because of the impact on the immune system. Now, since we are on the immune system and mistletoe, let me share what is the impact on the immune system. So, in a cancer patient, mistletoe is basically prescribed, number one, for as an adjuvant therapy. Many cancer patients come to you and they are already on chemotherapy and radiation, correct? Or target therapies.
Yes.
So we give it side by side, and then we tell them what do they want to do. Or we give mistletoe after their therapies are over as a prophylaxis, right? Secondly, it is given pre-surgery to prevent NK cell suppression. So you should know that any surgical procedure, any advanced surgery in a cancer patient leads to suppression of natural killer cells of the immune system. And that is why patients metastasize 6 months after surgery. Patients feel कि भाई operation तो हो गया, गांठ को निकाल दिया, सब कुछ अच्छा है, but it's not that. So NK cell suppression, so action on NK cell activity is very, very important. Number two. Number three, mistletoe also has a cytotoxic effect on the cancer cells directly via apoptosis, via a process called as programmed cell death. You all should know what is programmed cell death or apoptosis. So not only is it immunogenic, immunomodulatory, but it is also cytostatic. And mistletoe, as I mentioned, improves the quality of life in a cancer patient. For example, nausea, vomiting, fatigue. Many cancer patients come and tell you, "Oh, doctor, I'm so fatigued, I'm so tired." Fatigue is so very important, right? Because fatigue doesn't allow you to move. And if you don't move, your quality of life is affected. So it helps. Three. And number four, it is taken along with chemotherapy and radiation. So it has got four benefits. I repeat today, since we are towards the end of the presentation. It is immunomodulatory, strengthens the immune system. Number two, it helps to kill cells directly by apoptosis or programmed cell death. Number three, improves quality of life, most important, where vis-a-vis fatigue, better energy levels, better sleep, lesser depression, no nausea, no vomiting. And number four, it is used with chemotherapy and radiation. So all in all, along with homeopathy, when you are giving mistletoe, you are giving a therapy at a holistic level, which covers every aspect of suffering in a cancer patient.
That's
Um,
nice.
Dr. Zubin, like in chemotherapy or in target chemotherapy, we have like fixed cycles of 6 cycles or 7 cycles and like this. So, is there anything like that in mistletoe therapy? Also, like there are fixed cycles of certain injections and then again a break, and how it is generally done?
So basically, for stage 1 and stage 2 cancer patients, we give the therapy for about 1.5 to 2 years. And then after 1.5 years, when we monitor the patient, the clinical condition of the patient, the tumor markers, the immunological condition of the patient, vital parameters, bowel movements, detoxification, then after 2 years, we stop it. In stage 3 and stage 4 patients, we have to give it for a longer time period. Maybe I have several patients who take mistletoe for about 4 to 5 years. They are regularly on mistletoe, and they make a very interesting observation that when they are on the therapy, they feel so good, an internal feeling of well-being. That is so very important. Over here, in fact, this particular internal feeling of well-being means a patient feels lighter, a patient feels more active, a patient feels more fresh in their lives.
Zubin, in this long journey, you remember any case which has really touched you?
Oh boy, what a sensitive question. Yes, there are in fact there are several cases, but one case that I am treating right now, the lady has recovered completely. Case of stage 3 ovarian cancer detected in 2017, taken chemotherapy, surgery has been done, pan-hysterectomy has been done, chemotherapy has been given. 2 years later, she develops a relapse. Again, she takes the chemotherapy drug, and she comes back, and she knows that she's going to relapse. So she comes to me to prevent a future relapse. And she comes to for mistletoe. So we start her on mistletoe therapy, and she was doing well. And then she again has certain adhesions in the abdomen and certain peritoneal metastasis at a localized level. So 2 times she's got the relapse. Third relapse, she's on mistletoe right now. So she decides to get operated in Ambani Hospital. I go to Ambani Hospital. I counsel her. I said, go ahead. She gets operated. Adhesiolysis is done. Post surgery, I visit the hospital. I treat the patient as a homeopathic physician post surgery as well, along with the doctors. We start her on various homeopathic remedies. She recovers. She's put on target therapies, continues mistletoe for 1 to 2 years. And now, after feeling better, 4 years from a relapse, olaparib was given to her, which has been stopped, discontinued. 6 years on, 2017, now we are 24, 7 years on. She has stopped all immunomodulatory, all her target therapies. She only follows a holistic lifestyle pattern that I've advised her. She follows diet that I advise her, and mistletoe and homeopathy. So she's now nearly cured, stage 3 ovarian CA, detected in 2017. It's a long journey.
Great result.
Dr. Zubin, have you used Viscum album as a plant remedy in homeopathic remedy? Meaning, what is your experience with it in the cancer patients?
I have not used Viscum album per se because the provings, Shobha, do not actually show the development of some kind of mutation in cells. If you are going to prove Viscum album, it has to show some kind of changes, malignant changes in cellular tissue. So we have not seen that in any of the provings. So I am not using Viscum album as a homeopathic remedy at all.
Okay. Okay. Any other case study that you would like to share with us?
Yeah, I think I told you about Hydrastis case. I told you about the case of and even this case I've given calendula. And one thing I must make a mention over here to all homeopathic doctors and that I mean over the last about say 15, 16 years in my practice, I found out that it's very important only to take the presenting totality of the patient and not go by constitution remedy and constitution remedy. And I get this in every Tuesday when I teach at the medical college. Students ask me, sir, constitution remedy involves understanding data from a patient. So even today, it takes me 3 months to prescribe a constitution homeopathic remedy. So I only Shobha, Aditi, Kushala, Nirupama, and Anita, I only go by the presenting totality of the patient and I only take 2 to 3 symptoms and I give the remedy. And each time the presenting totality changes or remains the same. I'll give you an example. I had a diabetic patient at our OPD in the Homeopathy Medical College. And she had a long history. The student comes and presents the case, a long history, mind, aversion, desire, sleep, this. And I ask her, अभी आपको तकलीफ क्या होती है? आप बताइए, अभी आपको तकलीफ क्या होती है? तो she says, डॉक्टर साहब, मेरे को है ना, बॉडी में अंदर से कंपन होती है. अंदर से मेरे को कंपन होती है, ऐसे मेरे को लगता है कुछ हिल रहा है. Then I ask her about the tongue. The tongue is trembling. I ask her about her thirst. She is thirstless. Heaviness of the head. Gelsemium.
Yes.
So, and students know this in the OPD. Very important. I'll give you another case. So we only go by that. So I find that people are getting confused and very much overburdened by homeopathy, trying to make homeopathy so difficult. Another can tell you, I had a case of a patient with acute flatulent abdominal distension. Each time पेट में गैस होती है, मेरे को बैक पेन होता है. गैस होती है, बैक पेन होता है. Remedy is rhododendron. Flatus felt in the back. So if there is a message, the message, and I always, Anita, I told you, whenever I do a presentation in the US or Europe, I only have 2 slides, my journey and my message. My message is don't make homeopathy complex. It is very difficult to find the constitution remedy. Go by the presenting totality of the patient and make homeopathy a targeted practice. And you'll succeed.
Wonderful,
Actually, a
message.
very important lesson because so much data you collect through the story, and if you want to include everything in your totality, it becomes a very massive task. So this
Exactly.
lesson from you, just considering the presenting totality and whatever characteristics are present at that time, it just comes in your face and you have to pick that up.
I'll tell you another example, a quick example, quick case. Now here I am very, basically by nature, I'm very impulsive. So I think that is maybe inborn in me of my way of practice. I had a case in the homeopathic hospital in the OPD, severe migraine. I asked the patient, तकलीफ क्या होती है? वो कह रहे हैं तकलीफ होती है तब मेरे को यहाँ पे थोड़ा बहुत सुन लगता है. So the intern came and presented the long history. I was confused. So मुझे confused नहीं होना है होम्योपैथी में. I want to be clear in homeopathy. Am I right? तो ऐसे और क्या तकलीफ होती है? तो नहीं, मुझे यहाँ पे थोड़ा बहुत सुन लगता है, हेडेक होता है, ये होता है, वो होता है. I give meserium. One time meserium failure. 2 times failure, not better, not better. Then she comes to me the 4th time. And coincidentally, the OPD is light. So I am relaxed. I said, chalo bhai, aaj thoda aur baatcheet karte hain patients. I am relaxed. Very important. Sometimes we need luck also, Anita. I said, bataiye headache mein kya hota hai? And in the background, outside our Mumbai Homeopathic Hospital, there is drilling noise. The road is being constructed. I said, आपको सर दर्द कब करता है? पेशेंट इज सेइंग, मैं सुबह घर से निकली थी मीरा रोड से, तब दर्द नहीं हुआ, लेकिन ये आपका ये दिल का आवाज हुआ ना, तब से मेरे को दर्द होना चालू हो गया. But headache from noise are 60 remedies in homeopathy, correct? Then I asked her, I said, क्या होता है ये आवाज सुन के? तो she's saying, लगता है ये आवाज मेरे दिमाग को मार रहा है. Sensitive to noise, as if the noise penetrates the body, hits the brain. Theridion. No constitutional remedy. Theridion, and patient is much better. So this is what I have been doing. This is my observation. Please, I'm sharing with you what I do in my practice, and I find that this is very, very important.
Would you like to give any other inspiring message to the homeopaths so that they develop the confidence of taking such difficult cases?
Well, I think, Anita, it has to be the passion to practice homeopathy and the passion to heal a patient. You have to have the passion to heal a patient. Like, today being a Sunday, I had gone to treat a dog with osteosarcoma in Powai. And then I had another patient of kidney failure with renal cancer. So you can definitely, homeopathy has a very important role to play in the journey of a cancer patient, to alleviate side effects, understand the cancer psyche, and to be part of the journey, because in homeopathy, we take the full history of the patient. So the patient becomes close to the doctor. Oncologist will spend 5 to 7 minutes, 5 to 7 minutes, see tumor marker and give the remedy. So all homeopaths, I think you should make sure that you take the full history of the patient. You can definitely make a difference in the life of a cancer patient through homeopathy and mistletoe therapy.
Yeah. Thank you so much, Dr. Zubin, for such a wonderful message. And we hope that to learn from you more and more, learn how to apply this therapy, at the same time encourage all the homeopaths to take such challenging cases and apply mistletoe therapy in near future in oncology cases. Thank you once again.
Thank you. Thank you, Dr.
Thank you,
Thank you,
Dr. Zubin. Thank you very much.
Thank you. Thank you very much for inviting me. Thanks to Anita for giving me the opportunity. And if I can be of any help, do let me know. You have my contact details. And wonderful to see you all. And I hope whatever little time you have on a Sunday, it's 8:30 p.m., you enjoy with your family.
Thank you.
Thank you.
Thank you so much, Zubin.
Okay, bye.
Bye. Bye.
Bye.
Good night.